Hello my friends, welcome to Forensic Medicine by Dr. Paras, and now we are going to discuss chapter number 14, Electrical and the Transport Injuries, my dear friends. And in the electrical injuries, we'll see there are two type of currents. So which current is more dangerous? AC is more dangerous than the DC, my dear friends. And the ampere will decide the injury. More ampere, more injury will be there. So first word is ampere is directly proportional to the injury, my dear friends. More ampere current is there, then there will be more injury will be there. Ampere is a unit. Now, coming to the voltage. Sir, voltage is also directly proportional to the injury. More the voltage is there, more will be the injury. More voltage, more injury will be there. Then resistance, more the resistance, less will be the injury. So resistance is inversely proportional to the injury. So three factors right here we are having. Ampere and the voltage is directly proportional to the injury, and the resistance is inversely proportional to the injury. Now, what are the causes of death in the electrocution? Moment there is electrical injury, the causes of death can be electrical arrhythmias. Most common causes electrical arrhythmia, and the respiratory failure can be there. So if there is a electrical injury, so there will be the entry point and the exit point. So let's check according to, let's draw the table. According to the entry and the exit point, we'll see, according to the entry and the exit point, we'll see the cause of death. We'll see the cause of death. So this first we'll write entry point, entry point, entry point and exit point. And here is cause of death. Cause of death, my dear friends. If we see right here, sir, first thing is head to foot. Entry point is from head and it is coming out from the foot. Then the brain will be affected. The first thing is brain will be affected. Brain will be affected. Then there will be a brainstem paralysis. Brainstem paralysis. Brain will be affected as brainstem paralysis. Brainstem paralysis. Brainstem paralysis will be there. Plus there will be, if nervous supply will be gone, then respiratory depression can also happen. Respiratory depression. Respiratory depression can happen. Then second is from, yes, second you can draw like this. First is done. Okay. Now second is from right hand to the left hand. If current is going from right hand to the left hand, then there will be right hand to the left hand. The cause of death will be cardiac arrhythmias. Cardiac arrhythmias. Now, next one. Cardiac arrhythmias. Next one will be what, sir? Right hand to the right foot. Right hand to the right foot. Then intercostal muscle paralysis. Intercostal muscle paralysis will be there, which will lead to respiratory depression. Respiratory depression will be there. Then, sir, last one. There will be right hand to the left foot. Right hand to the left foot, we'll see the cause of death is cardiac arrhythmias. cardiac arrhythmias. So these are having we are having now the cause of death according to the entry point, my dear friends, according to the entry point. Now what are the postmortem finding we can find right here? So postmortem finding, we'll see what are the postmortem findings. In the skin finding, first we have, sir, jewel burn. Jewel burn is happening due to the low voltage burn, and the margins are raised. You can see right here in the jewel burns, the margins are raised. So you can see this, margins are raised in the jewel burn, skin finding. Second, microscopic features of the jewel burn, you need to remember, epidermal separation is there. The layer epidermis is separated, which will lead to the margins up. Plus blisters and vacuoles are seen sometimes what we will see, because epidermal separation is there, that is why we can see what's here, blisters and the vacuoles, done, sir. Now second finding on the skin, we can find what, sir, crocodile one. So crocodile one will see, sir, right here, it is due to the high voltage and multiple pitted lesions are there, and this skin is looking, it is resembling like the crocodile skin. It is resembling like the crocodile skin, my dear, crocodile. Third is current pearls, the deposition of metallic ions on the tissue. Onto the tissue. So these are the three findings you are going to see in case of the skin finding in the electrical injury. Then coming to the muscle finding. Muscle finding, at first go, there will be a Zenker's degeneration. What is Zenker's degeneration? Caused by passing of electricity through the muscle, which lead to the rhabdomyolysis or myoglobinuria. Muscle damage is going on. Now muscle finding, you will see in the urine, you will see the muscles coming outside because of the Zenker's degeneration. The electrical current will pass through the muscle, it will lead to the lysis of the muscle. Moment the lysis of muscle is there, it will come outside in the urine. In the urine, we'll see the muscle fibers. Done? Now, then coming to the bone finding. Bone finding, if we talk about, bone pearls are there, sir. The bone finding, what we are going to see, bone pearls. Bone pearls, high voltage electricity produce radio opaque densities on the X-rays we are going to see. Radio opaque, we can see through this, radio opaque, we cannot see that through that, and high voltage electricity is responsible for that, bones pearl. Then filigree burn is there. Filigree always seen with the lightning. Filigree is always seen with the lightning, my dear friends. Also known as Lichtenstein's flowers or ferning burn. Ferning pattern you can see right here, sir. It is seen in 4 to 48 hours. Ferning pattern, my dear friends. We can see right here, sir. Ferning pattern in the filigree burn, and which is happening because of the lightning, whatever the light is coming from the sky, my dear friends. Now coming to the next thing is Keraunoparalysis. The transient paralysis of lower limb following the lightning strike, and it is always accidental. Accidentally you are going somewhere, light came on to you, and there is a transient paralysis of the lower limb. You are not able to walk for some time. This is called as keraunoparalysis. Now we are moving on to the next topic, that is called as transport injuries, my dear friends. If we talk about the transport injuries, so you will see number one is pedestrian injury. The car is hitting the person on pedestrian. So you will see primary impact injury, mostly at the level of legs. If this is the car, and sir, car is hitting the person, like person is here, or I can draw more like this, where the car will hit mostly onto the legs, So due to the bumper of the car, this is bumper, the legs will get hit. Most common bone in the bumper fracture is tibia. This is important MCQ. Most common bone to be affected in case of bumper fracture would be your tibia, the lower bone, tibia, shin, tibia. So primary impact mostly at the level of legs due to bumper of car. Most common bone affected in a bumper fracture is tibia, my dear friends. Now coming to the secondary impact injury, mostly due to the bonnet or windshield. Now what will happen, sir? If I draw it again, I can draw it again. Primary impact, you understand. Now secondary impact, I'll draw first. So this is a car. This is a car. And person is like this. Now car hitted the person. There is a hit onto the legs. After hit onto the legs, the person head will fall here. Head will fall here. If car pressure is like this, head will fall here, my dear friends. It will lead to head injury. Yes, head injury will be there. Head injury, skeletal fracture, plus cervical injury will be there. Plus cervical injury will be there, sir. So secondary impact injury is when person is falling onto the bonnet or the windshield. Bonnet or the windshield. And if the head is striking this windshield, there will be a damage to the glass, glass shield. The glass damage, glass will be damaged, and because of glass damage on face you can see the sparrow feet mark. You can see what, sir? Sparrow feet mark. You can see what, sir? Sparrow feet marks. Now there will be a tertiary impact. Body is thrown away. Again we'll draw car. Now the person is walking, high speed car came and car gave it a blow and person was thrown away. Person was thrown away. Once the person was thrown away, there can be a chances that injury to the head can be there. There can be a chances if the person is rolling on the ground, there will be abrasion, there will be laceration. There will be abrasion, there will be laceration. There will be abrasion, there will be laceration. This is called as pedestrian injury if you are walking onto the road, my dear friends. Now, injury to the people in the car can also happen. So, in the car, what can happen? Head impact can be there. Head is hitting in the windscreen. Then on face, what you will see, sparrow feet mark are seen due to the broken windscreen. Broken windscreen. Then on neck, due to hyperextension of the neck, there will be a whiplash injury, my dear friends. So what can happen? Moment there is a sudden break. Sudden break can lead to your neck go like this. Moment your neck is going back like this, my dear friends. Moment your neck is going back like this, there will be hyperextension of the neck, and because of hyperextension of the neck, there will be a whiplash injury. Then your face is striking onto the window, and because of the glass, breaking down of the glass, there will be what's your sparrow feet mark. There will be a sparrow feet mark. Then steering will also hit. Steering will hitting the person lead to the tear on aorta. Lead to the ladder tear on aorta. Seat belt impact can also be there, sir. Seat belt impact, the most common organ damage would be the mesentery, and most common fracture bone would be the lumbar vertebra, and this fracture is called as chance fracture. You can see right here, sir. This fracture is called as chance fracture. Now, two people are sitting in the car. Now we'll compare them. What injuries they can get, my dear friends. So all those things can come to driver and the person who is sitting next to him. Is very important MCQ right here, sir. First we'll see, sir, there will be a sparrow feet mark. Sparrow feet mark. Next, coming to the whiplash injury. whiplash injury. Third, we are having the seat belt injury. Answer. Fourth, we are having the dashboard injury. Dashboard injury. Now driver, we compare two people here. So here we are having driver. Here we are having driver plus we are having the front seat, or you can say shotgun front seat. Victim. Let's see sparrow feet mark. The sparrow feet mark can be seen on both. Both will have impact, both can go to the glass shield and both can have the same impact. The sparrow feet mark can be seen on both. Then whiplash, yes, whiplash is also seen on both. Both can go like this. Now seat belt injury, my dear friends, this can also be seen in both. Seat belt can be seen in both, but dashboard injury is not seen in the driver side, but it can be seen in the victim side. So this is the chart to compare. So this is all about this chapter. Thank you so much.